YouTube. Hey, good afternoon, everybody. Hi, Lee. Hey, James. Hey, Jim. Oh, thanks, Robert. She's turning 1 next week, so can't believe it's been a year since she's been here. Definitely COVID baby. So yeah, she's old enough for I get to have her, and she's fending for herself with me. How did that come up? Okay, so what time is it? Okay, perfect. Wait a few more seconds, and then we'll get going with today's community meeting. Hey, Rukia, if you can make Monique, Dr. Shiba a panelist as well. She's going to present after me. So let's get going. Okay, good afternoon, everybody. Happy March. Happy end of March, almost end of March. It's been a while. Thank you for bearing with us. We had a couple conflicts the other week, so we had to push our meeting to later on in March, but we'll still be on schedule for our April 1. So moving ahead to the Pacific, the Asia Pacific region, Japan continues to decrease. Same with South Korea, though they're just coming down from their peak. And if you're paying attention to China and Hong Kong, which we typically haven't included, we might have to for our next one in April, which is in a couple of weeks, just because of the massive surge that's the Omicron surge that's going on. Oh, you can't see my screen. I apologize. I didn't even see my screen. Thank you, Rukia, for the heads up. Can you see it now? Let me go back. See, I'm out of Zoom practice. Okay, so if you have any questions or comments, place them in the chat or the Q&A. I have them both queued up, but just rewinding just a little bit. Yeah, Japan trending down. They've been trending down for a while. South Korea is just starting to tip down. Once again, they were hit a little harder by Omicron. I think it's a trend. I can't prove any correlation, but the countries that did very well with the initial COVID surge, through the tried and true, contact tracing, testing, quarantine, ISO quarantine. They didn't have my suspicion, and this is not proven. My gut feeling is they didn't have as much natural immunity that the other countries that went through the massive first surge did. So when Omicron is hitting them, or when Omicron hit those countries, they really suffered even more so because of the increased transmissibility and the lack of a baseline level of natural immunity. I haven't seen any studies yet, but that's just my gut feeling. And then India obviously came down from Omicron and continued just to be flat for now. National overview, I think safe to say as a whole, once again, we're at a hold right now. Obviously there are still some pockets if you look at this map with the dark red, but it's really come down from a mass dark red map to very lightly colored. Once again, we are seeing a slight uptick of BA2, but once again, it's still difficult to tell how much of an impact that's really going to be, and we'll see how much we can glean from Europe. For Arizona, California, no major differences from their state trends compared to the national trends. And then same with Nevada and Texas. Texas is slightly going up, but once again, at this point, not really paying too much in daily or even weekly fluctuations. So I think a lot of state health departments, including ours, have stopped reporting daily cases. For Hawaii's overview, We are definitely, the lowest we've been for a very long time for both cases per 100,000 and test positivity rate. Part of that could be due to decreased testing overall in terms of capacity and just people not testing as much, and due to our vaccination rates as well. Once again, we've pretty much reached a point where I think this is the highest we're going to go at any given time with regards to vaccination status for our state. And then our forecast, not predicting, not forecasting in the next couple of weeks anything major, and just want to point out that even though we have a lot of historical data, we are affected by the change in reporting frequencies by Department of Health. So at this point, shifting from the Omicron and stuff about that to starting to look at for me and also for HiPAM, what are the other impacts, the excess morbidity, excess mortality, and then some looking longer term at some of the other public health and social determinants of health impacts. So I just wanted to highlight these three. Obviously, there's always a lot, but my colleague Dr. Shiba is going to present on her and her team's great work. So I wanted to just keep this kind of short and sweet. So yesterday, Moderna is going to, through their press release, stated they're going to submit in the next couple of weeks an EUA for the FDA to authorize this COVID vaccine for kids under 6. It's important to note that when we last met, I was given the same update for Pfizer. Pfizer still has not received an EUA for their dose. I think there were some issues with regards to efficacy and safety. So Moderna, this is good news in terms of Moderna stepping up. Important to note that I think for clinicians, first, do no harm. There was no severe disease seen or signs of myocarditis in the younger populations with regards to the safety of the Moderna vaccine. It is important to note that vaccine efficacy definitely lower than what we saw or what we would have expected in the adult populations. And there was a decent sample size for a clinical trial. But that leads to the second point in terms of there was a study conducted during the Omicron surge where they looked at unvaccinated children and adults and really wanted to compare the antibody levels in the unvaccinated based on age. And while the N was small overall in terms of those with previous COVID-19 infections, if you're looking at the relative associations, in children 0 to 4 years old compared to adults, they had 13 times higher neutralizing antibodies. And then for those 5 to 17, 9 times higher than adults. So, statistically, we've seen, across the populations that are young keiki, including Ember here, if they were to get infected, strong probability that they'll be fine or have mild symptoms and develop antibodies. And this is a good sign. And then if you get them vaccinated, regardless if, they had the vaccine or not, they're going to still be protected even if they got infected. So once again, it's at a population level, it's pretty clear. Obviously individually, each child is different. Each child and each family has their own risk calculus that they have to look at if they're immunocompromised, if they're living in a multi-generational household. But we're continuing to see evidence that supports that either vaccinations or just continue to keep our young keiki healthy is the best way to keep them going as we kind of emerge from the past couple years of COVID. And then finally, talking about leaving starting to pivot from the acute COVID symptoms and associations and outcomes to longer term. There's a lot of studies now focusing on long COVID, and this one I liked in particular because it's trying to look at the cognitive aspects because that's oftentimes less direct in terms of identification. And so of the participants, I think it was about 3,000 to 4,000 total, but of the 120 participants with long COVID, these were the top five reported problems as it pertains to cognitive capabilities. And so, it's not just the internal organs that we're starting to see impacts of long COVID, but also cognitive capabilities as well. And then obviously that's going to result in, secondary and tertiary impacts to their lives and social determinants of health. So, for me, I love looking at the immune response. So there's still research to be done in terms of looking for the immunologic causal pathways with regards to long COVID and these cognitive adverse health outcomes. But once again, we're going to continue to see studies looking focusing on long COVID. And I think it's important to, while it's still important to look at the immediate clinical outcomes, we also have to look at the long term as well and start to plan and inform policymakers for the long-term impacts of COVID as well. So let me see if there are any questions, which I do not see in the chat or Q&A. So with that, I'm going to stop sharing and then hand it off to my great colleague, Dr. Shiba. Let's see. Yeah, so thanks, Robert. Sorry, I didn't see your chat. So yeah, definitely below the 50% FDA threshold, I'm definitely not even close to the decision making, in the FDA. So I can't say what's going to happen. You can only look at the data that's been shared from Moderna publicly, and I think that's all they shared. They haven't really shared the ins and outs of the rest of the vaccine efficacy and all their analysis. So can't really speak to that. Yeah. So for South Korea and then also for Hong Kong, and China, I think it's for me as an epidemiologist, it's just interesting in terms of it's just a natural experiment, and this is just my gut reaction, nothing grounded, and I haven't had as much time to look if there's any other research that's been done. But it makes sense if you look at China, Hong Kong, South Korea, the Asian countries that did tremendously well in the beginning, right? They had very little COVID infections, compared to Europe and the United States. And obviously we know now that the original strain is less infectious than Delta or the Alpha or Omicron. So now that they have a much more virulent and infectious strain of it in a population that's pretty, you could say it's almost a naive population, it would make sense that we're seeing it. And obviously that's not the only reason. Hong Kong is very densely populated. And same with South Korea as well, and parts and big cities in China. So there's definitely a lot of other causal factors as well. And yes, absolutely, the listening and reading, listening to the news, NPR, and then also reading the news from Hong Kong, it's obvious that the health officials admitted that they kind of let down their guard and didn't, take the time to prepare enough to focus on protecting the vulnerable populations. And there's obviously some other political and social dynamics there that made it a little difficult to vaccinate some of the populations as well. But yeah, great points, and I'll dig a little more to see if there's any research that's been done, in terms of the natural experiment in Asia versus the rest of the world. Okay, nothing else. I will hand off to Dr. Shiba.
All right, so thank you, Thomas. So I'm going to present a little bit what the latest modeling that we have. It's been fairly quiet on our side because the cases have been decreasing. So it gave us an opportunity to sort of clean a little bit the code, to rethink some of the approach that we have made, and to think a little bit ahead of time as well. So we are also working in introducing other attributes to the models that are, like, for instance, it's been established now that there was an increase in drug abuse during the pandemic. So we're trying to incorporate that into the model. We have some leads, we have some ideas. So we're going to be looking at that and trying to go beyond just COVID with the modelings that we can do. So the current update, so there is the BA2 Omicron, the new variant that is coming. So far it hasn't created, at least here, a surge that would come as alarming. We'll see there is a little increase in Honolulu right now, but again, we'll see the plots and the numbers. Then the parameters have been adjusted. We tried to understand a little better the hospitalization, and we'll see. So the parameters that we had used for risk of hospitalization, depending on what county you are, we had to adjust that. And then those risks were very different with the Omicron than with the Delta, as everybody knows. We also updated the excess death, but it's still a little early to compare the Delta to the Omicron surge. And we're waiting a few more weeks because there is a lag in really how the deaths are recorded. So right now, we don't still have final numbers for February and March. And another thing that we've been working on, and the student trade that has been working on that will present, we were looking at island like Tonga or the New Zealand that had a very strict lockdown and that then started reopening. And what type of scenario? We had two scenarios versus like more a Delta-like situation versus an Omicron-like situation. And then we'll see what one versus the other would look like if you come completely vulnerable at the beginning of a Delta surge or a Omicron surge, and then see which one is actually preferable to the other one. That depends. There are a lot of factors. They're just different, and we will highlight those differences. Okay, so I'll go to the next slide. So here, did everybody see me moving to the next slide? Because sometimes it does not work. So the slide,
it's good.
Yep, it's good. Okay. So it's about lifting mitigation measures. So as you know, the masks are coming down, and then the safe travel program is coming down as well. So they're coming to an halt. So we wanted to incorporate that into the model and see how that would impact the different curves. So we can, like the simulation as of now, they're showing that there'll be a small increase, but it does not show any beginning of an exponential surge. So it seems that we are in good shape right now to go ahead with those lifting measures. It is as of now, there is the B2 variant has been found on the island. It is like mostly on Maui at 22%, and in Honolulu 17%, Hawaii Island is 8%, and Kauai only 1%. So it is gaining some speed, and we're going to be monitoring that and see how that can change the game. It's unclear right now about the hospitalization, whether it's going to go a little down or hospitalization lag. So this is something that we'll keep monitoring. So here our spiral data. So they show very clearly, if you look at the one on the top middle, this is the cases. On the top left, the hospitalization. On the top, on the bottom right, bottom left, hospitalization, bottom right is the ICU. So you can see the Omicron huge surge in terms of the cases. Hospitalization was a little smaller during the Omicron surge, which is the top blue blurb here versus the bottom one. And then ICU, the surge was actually bigger. There was a higher ICU rate count during the Delta than the Omicron, even though the cases were much higher. All right, this is the death, the spiral for the death. And again, one full rotation represents a year, and we can see death lag behind everything else, but it's just like it seems to be on a steady rise. So this is test positivity. So we were interested to see the vertical bar graphs is when the data are not available. For a little bit, the Department of Health stopped counting all the tests. They were counting the positive test, but not the negative one. So we don't have the positivity during that time, but it's back. And now we computed the positivity. So you can see the brown curve is the 7-day average. And you can see on Honolulu that it is the one with the blue, the top left. You can see that it's going back up, the positivity. You also see that the positivity didn't reach the level, back down the level that it was pre-Omicron surge. So that's something to keep in mind as well, because we're studying at a positivity level that is higher. Again, this is regarding cases, right? And we know that hospitalization have been much decreased. I'll have a plot about that during the Omicron than it was for the Delta. For the other one, it's mostly the positivity for the other country has been decreasing, and it's at rather low level right now. So reduction in transmission and hospitalization, the risk. So the largest drop in hospitalization rate is observed like due to the Omicron versus the Delta is observed for Honolulu, which is also the county that has the largest vaccination rate. And so I will give you a visual that is here in order to highlight that. So you can see the blue one and the orange one. So the blue curve is represent, like in the model, we have different stages. Once you become symptomatic, you're symptomatic day 1, and then you go automatically to day 2, and then you go automatically to day 3, and then you have stages where you can stay in that stage for a certain period of time if you're symptomatic. And then those stages, stage 3 and 4, there is a certain risk to end up in the hospital. And those are the parameters that we've been calibrating throughout the pandemic. So the blue line is if you're in what we have as stage 4 in the model, the risk 14% during the end of the Delta. So that was what corresponded to the Delta. And now the risk to get hospitalized is at 3% if you're stage 4 of symptomatic for the Omicron. And then the orange one is if you are a little less severe symptomatic, your chances to end up in the hospital are even lower. So we can see that the gap is the largest in Honolulu. And then we can see Hawaii County is the one that is currently presenting, based on our estimate and our parameter, is the county presenting the largest risk to end up in the hospital. And it's also the one that has the lowest vaccination rate. So that's maybe the case. The daily cases that we had in the hospitalized, there were more vulnerable people that were not vaccinated during the Omicron surge on the Hawaii island. So now I will just check into the chat before I go. Do I see seasonality? So that's a good question. Let me go back and oops. So here we sort of see seasonality, like in the hospitalization, we can see the waves, like usually in the fall. And now we have one, the Omicron was in the early year, but otherwise that's not clear. So we're going to have to wait a little bit July to see if we're going to see a new increase that will be due to the B2 probably. So again, a little bit of seasonality. Mostly we can see that in hospitalization here that we have, like for the first trimester and then sort of the third trimester. Okay, let me just look at the Q&A. There is nothing, so I will just continue. Is seasonality more weighted? No, we don't weight more seasonality or NPI. I'm not sure, what do you mean by NPI?
Like masks, non-pharmaceutical interventions, Monique.
Oh, I see. No, it's not.
And then one note
Yeah.
for Robert and the rest. So as it pertains to seasonality, you know, we, at least for Hawaii and the flu, right? We don't have a traditional flu season per se, because, you know, before COVID, Hawaii is a destination for many reasons, but, you know, weather is a big one. And so, you know, when it's the northern hemisphere flu season, right, we get people escaping the winters, you know, in the winter months, traditional winter months. But then we also, in our summers, that's the winter for the southern hemisphere, and they have their southern hemisphere flu strains as well. You know, COVID we don't have that established pattern yet, but just want to put it out there that, you know, that might be a possibility. We don't know yet, but in terms of seasonality, like Monique said, it's too soon. But, you know, historically, you know, we don't typically have 6 months out of the year where we don't really have a flu season, just because of our unique location and as a destination, you know, tourist destination hotspot. Thanks, Monique.
Yep, thanks, Thomas. So here we have, this is the fit for Honolulu and the latest data. So now, as you probably, most of you know, we get the data like once a week only. We still get the daily data, but it's only updated every Wednesday. So from one Wednesday to the next, we're a little bit in the dark and not really not able to see if the numbers are going up or down. So, but here on the upper right, you have sort of the zoom at what is happening right now. And we see that we had sort of a plateau. It was going down and it came up a little bit in Honolulu. It's still a low increase, but it's whether this is a sign that the B2 is starting to take off and at least for the daily cases going up, that's not clear. In terms of the hospitalization, we're in the upper part of the cone in the red, but the numbers are small right now. So there is no overwhelming of the hospital facility in Honolulu. So here is, I think this is the interesting slide where we're forecasting with the lifting the measures. So again, two measures like no mask and then no safe travel. So we added both together, it's the red line. So you can see a small increase, but it does not create at that stage under our estimate. Like again, this is for the B1 mutation of the variant, the Omicron B1 with the B2 that might change. This is only the daily cases as of now. And so we can see no mask and no safe travel is the red curve. We can see in blue, that's the no mask, but safe travel, which is maintained. Now this might change. This is assuming that the safe travel, it's hard to predict what this, if like now that we lift the safe travel, if we're going to have a huge surge of traveler, that's possible. That's a little bit expected, but it's hard to make a prediction on that. So this is assuming a constant level of safe travel, at least for the next 2 weeks, 3 weeks to come. Then no mask is the blue line, and then the black one is corresponds to have no to take off the safe travel, but maintaining masks. So we see that as of now, lifting those measures seems to be a fairly safe scenario. We're going to look at the other county. So this is Hawaii County. We can see that the daily cases are plateauing at the lowest level. They're very low right now. We have hospitalization that are really like on every other county but Honolulu, the hospitalization is down to a single digit, which is really nice. We've seen a little bit of a surge in hospitalization. If you look at the zoom on the very right, the last like end of the week, last week and beginning of this week. So this is again, we need to monitor that and see what happens. So this is also the scenario projecting lifting the measure. Again, so the red curve here, it does not show an exponential curve, it shows a rise. That is maybe, that might be a little bit more concerning than it was for Honolulu, that was more flat. However, it does plateau pretty quickly. Again, this has to be monitored because this is with the B1 variant. So we'll see the B2 variant is going probably to have a little higher surge in cases, but it needs to be monitored what's going to be the impact of the B2 variant on the hospitalization. So Maui County is doing well. The daily cases are down, plateauing at the lowest level as well. The hospitalization, they were plateauing at like a higher level than expected for a while, but they seem very lately, very recently to be decreasing to a smaller number. So that's a good sign. It's unclear why for sometimes they were plateauing at that level because we didn't had that behavior for the daily cases. Again, we have to remember something like with positivity now, a lot of people do not get tested or they have at-home testing. So it is very hard to understand those daily cases. Hospitalization is a little safer parameter to use in order to understand what's the situation. And then for Maui, again, the lifting both the no mask and the safe travel create a surge, but we're looking, it does not goes into an exponential surge, it still plateau and comes back down. And everything is still fairly under control in those. I'm just looking at the chat and the questions. Science perform, non-private tests are performed. Yeah, Yes, exactly. That's exactly what I was mentioning. Like we are under testing, so it is very possible that we have a very biased view of what the situation is. And what causes the reduced growth rate around April 1st. So let me go back, like this is for a specific county or for here, I guess. Like this is just like April 1st is here. So we have a growth depending on what scenario we are. There is no, I'm not sure I understand what the reduced growth rate around April 1st. Maybe you're referring to another county. Let me just go to Kauai. So Kauai here, again, it keeps going down. We had a little bit of a surge in daily cases, but again, they're so small that it looks big. When you go from 2 to 4, it looks like it's a big difference. Then we have here the hospitalization is now at 0 on Kauai. It has been plateauing at 0, which is a very desirable outcome that we have. And this is the projection based on the current data for the Kauai lifting the measures. All right, so here is just comparing the counties. So those are the daily cases. We want to understand how the county did through the Delta surge and then the Omicron surge. So we can see this is normalized by 100,000 individual for each county. So then we can compare. So we can see for the on the top left, we can see Honolulu was the one where everything happened on the very first surge. Like this is like the first surge, we basically don't see it, but then in the summer of 2020, and then we see that Hawaii was the one that got that was most impacted by the Delta surge. But then in order, like for the Omicron, Maui and Kauai were the one that were the most impacted and that had the most significant surge in terms with respect to their population density here. Oh, I see. The case projection have a concave band. This is the concave. This is really that's not something that we did input. It's just that there is not enough. The transmission is not enough in order to overcome the vaccination. There is suddenly more transmission. So you go up, but it's concave down because it's overwhelmed by the vaccination rate at this in there. Then what do we have here? Yeah, so the hospitalization. So we can see hospitalization during the Omicron were most seen in Honolulu and Maui, and a little at a lesser level for Kauai and the Big Island. So this provides again a comparison. We can see that the Big Island and Honolulu were the most impacted in terms of the hospitalization during the Delta curve, but then Maui got more impacted during the Omicron curve. So again, here the idea is really to try to understand, and we have a paper that is going to appear in PLO 1 very shortly, that there is heterogeneity, that all the islands are different, they have different ratio, tourist versus residents. So lifting the safe travel program is going to have a different impact depending on different county that you are. So then this is just a little update on the excess death that we have from March to now. Those are the US, so you can see there was consistent excess death due to the COVID-19 during the pandemic for the US. However, for Hawaii, we were usually during the pandemic under the projected numbers for the number of deaths, right? So which was good. There was a surge and there was excess death during the Delta surge, and we have some now coming during the Omicron, but now the last 4 bar graph, they should be taken with caution because this is not completely established. The data are not final. When you have the red dots, this is when Omicron created the excess death. And then if you compare both, you can see that we've been following in terms of the excess death, This is normalized by the population. The orange one is the US, the blue one is Hawaii. So we only overcame the US in Hawaii during the Delta surge, but otherwise we'll always be under, doing much better, doing sort of equivalent during the Delta surge, but the Omicron was better in control in Hawaii. So now I'm going to leave my student Trey. He's going to discuss the scenario that we've done for isolated islands that have been under strict lockdown and that are starting to reopen.
Okay, can everyone hear me?
Yes, we can.
So as Dr. Chiba mentioned, as cases are coming down, we had some time to play around a bit, think about some other things. And so being island countries, it seemed natural to try to take some things that we learned from here in Hawaii and apply them to some other countries. So we're looking at Tonga and New Zealand, and we sort of have two different types of simulations that we ran. On Tonga, we're interested in if someone comes into the country using the Tonga specifics, the breakdown of the population, and the assumptions about vaccinations. What would that be like if someone entered and the virus was able to spread? And how would it be different if we assumed the virus was, say, a Delta variant, basing that off of the data from Hawaii and what Delta did here, or if it was an Omicron variant, comparing that to, again, the numbers that we had here. I think I used a combination of Maui and the Big Island to do the Tonga comparison, whereas on New Zealand, I used Oahu and the Big Island. So that's what we're gonna do. And so I guess the next slide, we'll see the Delta variant is, these are more assumptions. So we're sampling from the real data in Hawaii, from daily cases, what percentage is going to the hospital, what percentage is going to the ICU, and we're going to use that to maybe not say which is better or worse necessarily, but just to highlight the differences and how nuanced it can be, and how it's important to consider all of the factors, especially in public policy and also in people's own decisions that they make on their behaviors. So this is cases. And so you'll see there on the bottom left is the new daily cases, again, assuming a Tonga-like population and assuming transmission and spread based off of how we saw the Delta here in Hawaii. And you see what the curves are as they get darker is the vaccination, VAX1, meaning people who have received at least one dose. And so you see there's a very dramatic effect as you go from 60% with one vaccination up to 71%, which was the true number when I wrote the simulation and we made that graph. Juxtaposed to the blue curve, which is the Omicron-like assumptions, the vaccination has a much more modest effect as you increase the vax number each percent. And then most strikingly is the upper right, which is to really see how different cases can be between the two variants. And of course, you see in the blue, it's an incredibly sharp high spike versus the red is very long and drawn out. I think that's a 2-year picture there. You see it's sort of over after, say, a year and a half or 200 days in the blue, but the red much more mild in cases, but taking a much longer time for that to happen. And then as we go through, this is what I was mentioning, this is sort of the importance of considering all the data, not just, say, cases, and how, a decision maker, a policy maker would have to look at this. And again, people themselves deciding for themselves. The hospitalizations, we knew that although Omicron was more transmissible, it had more mild numbers going to the hospital and even more to the ICU. So as we see, again, that same pattern of the red as it darkens, more dramatic than the blue, but more strikingly in the top right, the pictures sort of converge in a way. They become more and more similar. The stark contrast between the height of the spike and the width of the red hump become more and more comparable. And down at the ICU, this is really when you see, okay, this is not as clear as we thought. If you are only considering cases, maybe you would have a knee-jerk reaction that you'd say, oh, Omicron is so much worse. But you see here, in fact, neither variant overwhelms the hospitalization or the ICU, at least in terms of this scenario with these assumptions. And maybe that's better. It's a 30 spike instead of maybe around 10 or 15. But you can see, like I mentioned, that within 200 days, it's back down to 0. Whereas depending on the vax level for the Delta, you're just in the thick of things, and it's still dragging on longer. And so we didn't have actual good Tonga data to compare. Dr. Shiba, can you try go like back forth? This happened to me before. It was like stuck between. Okay, yeah, that was perfect. So we didn't have the best Tonga data to compare to, but for New Zealand, we had good numbers. So similarly, we're doing the same thing where, knowing that Tonga and New Zealand had these very strict, no travelers allowed measures. And so we're trying to see the effect of a virus entering the country, even with the very strong vax numbers. So you saw again, Tonga had 71 with 1 dose. That still wasn't really enough to prevent an outbreak. And similarly here, you see these really high vax numbers, 77.3% with 2 doses, and still, when the population has no natural immunity, you can see a severe spike. So indeed, New Zealand opened their borders, and this is the real data. You're seeing the incredibly flat data starting January 3rd, but then in January of 2022, 2 years later, when they open back up, you see the elbow and the very sharp spiking of the data. And so the idea was to sort of validate some of the approaches for a country that, or an island rather, that wasn't just Hawaii. And so this is showing that, and showing actually that a lot of our assumptions are doing quite good. So I seeded the model with, again, all of the assumptions. The breakdown of New Zealand's data or population is about 5 million. Things like this, and using, like I said, a combination of Oahu and the Big Island. And so you see that if you put in those realistic numbers of the infected individuals leading up to February 1st, and then you model for the month after that, the model fits very well the behavior of the curve, with the only wrinkle being that we're not really sure still, for some of these variants, what the percentage of is from someone showing symptoms who's infected versus an asymptomatic who's infected. So instead of varying vax level, like on the last set of slides, what I'm varying between those curves is the assumption on how many people are sick and don't know it for every person who is sick and does know it. So every person that is sick and tested, and so it shows up as a I infected in the serum model, how many are there in the E in the exposed, which is like the asymptomatic infected. And you see somewhere between 1 and 2, those blue curves, if there's 1 person per every 1 asymptomatic per symptomatic, or 2, then those data fit well. And then the last thing I wanted to note was, you do see, of course, the model is built on exponentials in some ways. It's passing, but the green curve really didn't turn around like it might have been hinting there. I just checked now. So yesterday's numbers, the average daily cases was 17,000. If you go 3 weeks ago, the average daily cases was 17,000. So they really have been at a very high number for the last 3 weeks. And it actually remains to be seen what they're going to do there. It seems actually that they also believe that they might have gotten through the worst of it and they've seen the peak, but it's also probably too early to tell. And like I said, it's really just been constant for 3 weeks now.
Great, thank you. So here a little bit of the ICU, the rest of the simulation, but thank you, Trey. Trey is also working right now on Ukraine, Poland, and Russia. We know that like war zone or usually great platform for disease to spread and etc. There is no data right now, so we're trying to use our model to try to understand and depict a picture of what could be actually the situation over there, and do that. All right, so this is, I would like to take the opportunity that Trey presented. He's a graduate student in the math department. Most of the simulations that you've seen today, they're made by Pratik, which is also a graduate student in the math department. And we have inputs from a lot of undergraduate students in the math department. Rukia, who has been the HiPAM communicator and sending the email and also maintaining the website and collecting data for us, he's also a graduate student in the math department. And we're going to grow the team a little bit in like by the end of the semester through the end of June. And here is one of the venture that we're going to do with the growing team for that meantime is to do. So one aspect, and that sort of respond to one of the questions that was in the chat by James, it was like visualization. I think we have to rethink a little bit about visualization. What is the best way, how to visualize so that we really understand the big picture. And so a graduate student is going to be hired to do some 3D simulation, some animation, and possibly some VR stuff during a 6 weeks period to try to really get some material and share and see what worked, what did not. And then another venture that we're doing and that we're going to be quite active on, we started on that, is to do a lot of outreach and K-12 lesson to bring all the tools, the modeling, the data, the computational aspect back to the school, to use that opportunity to also grow the skills of the next generation. So we've started there, and this can be found, we're starting to fill that out on the HiPAM website. You have now a new education page that is over there with education and material. So there are quizzes for the community, and we're going to try to see how we can launch that so that more people can participate. So quiz number 3, that's just a picture that was there. We were there with Thomas at the very beginning of the COVID, when there was a lot of the surge, and we were talking to the athletics to make sure that they had a good understanding of what it means to be protected, because if one of them was sick, then the entire team would have to stop practicing, etc. So we talked with them. And quiz number 3, we have 4 quizzes that are up right now. Each quiz has 7 questions, and the question gets harder as you move on to the quiz. And the quiz 3 is about impact, and one aspect of that was on athletics and sport in general. Then we're also developing lesson plans. So we have a unit on disaster and disease in Math 100 for 3 semesters now. We've been doing, it's 4 weeks. It's a set of different worksheets that we do active learning with the Math 100 student that learn to look at the data from COVID, that try to understand what's the difference between a linear model, an exponential model, etc. Collect some of the data and try to quantify that. And then like the primary goal was to raise awareness about the situation and make sure that they could like get something out of the data that they would read in the newspaper, and some skill in order to analyze them. And now we started working. So this is going to be used also to do some high school education and material lesson plan, where we're going to also introduce some computational model where they can change some parameter and then see how things evolve. We are also at the elementary school and the middle school, so we are working on that and producing some lesson plan that will be used by them at that level. We are going to try to go and visit the school in end of May and June. We also are in contact with the Institute for Human Services. Right now, we are going to help tutoring their kids. It has been hard for them to adjust to the online service. So we're trying to provide a service with HiPAM to the community by tutoring the kids at the IHS, and also producing lesson plan for them, and doing some Be a Scientist Night, which is an event that we have done in the past. So that's a little bit where we're going. We're going to keep modeling Again, to summarize, we're going to keep modeling the island here, every county. We're going to try to add other feature like drug abuse into the model and try to understand correlation because we have data about that. We're going to try to model also a little bit what is happening in Ukraine and Russia and other part of the world where data are more difficult to access now, but we have models that have been validated, and we're also going to try to go a little more into and prepare some material for our community. So that's where we are, and Thomas, I'll give it back to you.
Thank you so much, Monique and Trey and Pratik and Rukia and Kiani for everybody's hard work. You know, this is definitely been a labor of love for a lot of us from the beginning, but grateful for the support from General Hara and the community. But honestly, you know, looking back, I think it's gonna be 2 years from the beginning in terms of when I was put on orders. It's really been a community effort, and I'm glad that 2 years later we're still moving strong on this and, you know, pivoting to issues that are related to COVID. And thankfully we have the ability to look at some other issues and not just having to do the reaction to a spike. So thank you to everybody for your participation. Monique for leading the students. I think we're going to see it pay off, you know, in our future researchers. So excited to see that. And yeah, we will see everybody in a few weeks. You'll get an email from Rukia for our April meeting. And until then, you know, stay safe, and it'll be interesting to see what our state looks like after tomorrow midnight. You know, just curious to see how many are just going to go crazy and how many are just going to just move, you know, keep going as if nothing has changed. But stay safe, everybody, and we will see you guys in a couple weeks. Take care. Aloha.